Tonight on Legislative Review. A bill to expand automatic voter registration in Washington. Plus, limiting the use of restraint and isolation in schools. And allowing psychologists to prescribe. That's coming up on Legislative Review. Thanks for joining us for Legislative Review. I'm Mike Bay, standing in for Angela Nolasco.
Senate Bill 5077. The Secretary will read.
A bill aimed at expanding automatic voter registration in Washington was passed in the Senate Wednesday afternoon. Right now, so-called motor voter means enhanced driver's license or identity card applicants are automatically registered to vote. Senate Bill 5077 proposes expanding that, with federal approval, to other state agencies like the Department of Corrections and Washington Health Benefit Exchange. Supporters say it will reach more people across the state, especially historically underserved and immigrant communities. Proponents also say it will remove barriers and ensure every lawful voter who's eligible to register can do so, like formerly incarcerated individuals re-entering society who want to participate in the civics process. But not everyone is on board. Critics say the issue isn't about voter access, but election security. They argue that people's data privacy could be compromised. Some also doubt that it has enough safeguards, and that the Health Benefit Exchange would move from an opt-in system to an automatic registration system without people's consent. Democratic Prime sponsor Javier Valdez spoke on his bill during final passage.
This is not an automatic. If when we pass this bill and should this bill make it to the governor's desk, that it'll be an automatic. Actually, we'll take federal approval for this, and but we want to make sure that once we are able to get federal approval, that our Secretary of State's office will be ready to go to and start implementing that.
Speaking in opposition, Republican Senator Jeff Wilson.
This bill flips consent on its head. Dealing with the Health Benefit Exchange, we're talking about information that may not just be yours, your data, but it could be your family's.
The Senate took a floor vote.
Mr. President, 30 ayes, 19 nay.
Having received the constitutional majority, Senate Bill 5077 is declared passed.
It now heads to the House for deliberation.
We will start with Senate Bill 5654.
A number of Democratic senators are pushing forward new legislation on how schools handle student behavior when it comes to physical restraint and isolation. Senate Bill 5654, which was heard by the Senate Early Learning and K-12 Education Committee Thursday, aims to prohibit student isolation with certain time exemptions in preschool to 5th grade starting in 2027. The bill would also ban chemical restraints and the construction of isolation rooms used in schools to manage disruptive students. There is a temporary exemption in the bill that would apply to schools following strict guidelines, like receiving medical advice and parental permission. In cases where physical restraint is used, schools would be required to follow strict protocols, like parental notification within 24 hours, adequate staff training, and limiting the use of restraint only when there's a serious risk of harm. Schools would also be required to report incidents involving restraint or isolation, not only to parents but to the state, which would be made publicly available. Senate Bill 5654 proposes more staff training on de-escalation techniques and mental health support, so teachers and administrators could better handle challenging situations without resorting to physical methods. Democratic Senator Claire Wilson sponsored the bill.
So the bill does prohibit chemical and mechanical restraint. It modifies requirements for reporting, and it establishes state compliance monitoring and support. Restraint and isolation poses an incredible risk, not only for the young people in our schools, but the staff. It's physical risk, it's emotional risk, it's trauma, and for many young children, it's re-traumatizing them in ways that oftentimes we don't know as school staff that young kids have experienced before.
Advocates for the bill say it's about protecting kids, while some educators are concerned about how schools will adapt. Disability rights advocates also weighed in, saying that if passed, the bill could change how Washington schools address behaviors of students with disabilities, who they say are disproportionately affected by these practices. Andrea Kadlec, an attorney for Disability Rights Washington, spoke in favor of the bill.
there's nothing that in this law that would change that. The room just can't be locked. We know that there are better ways to manage classrooms that reduce reliance on restraint and isolation, and that's really the focus of this bill, to provide those upstream supports and that on the ground in the classroom support for teachers so they have the tools they need and they don't have to rely on these harmful practices. Thank you.
Special education teacher Jeffrey Callis of Lilac Learning Center in Tacoma testified against the bill.
Outright elimination of the use of closed safety rooms will make our schools less safe for both students and staff. Many students with severe disabilities cannot be safely restrained, and in some cases, isolation is actually the safest and least traumatic option to prevent harm to them and to others. Achieving this requires a significant investment in time and professional development, but much of which is not allowed for in current school contracts.
Special education paraeducator Bree Nelson shared her recommendations with the committee.
Recently, I had a behavior student kick me in my face. This is the same student has injured me 6 times this year alone. My son is on an IEP due to his autism, and this bill's changes to current practice would prevent my son's school from being able to do all that they can do to support my son's needs. None of us want to be in a situation where we're forced to put a student in a restraint. However, the way to reduce this use of this tool is to fund our classrooms so they are fully staffed to keep kids and staff safe.
And we will now move to the final bill on our agenda today. I'd like to open the hearing on Senate Bill 5112.
The Senate Health and Long-Term Care Committee convened Thursday to discuss a bill concerning behavioral health care. Senate Bill 5112 proposes to allow psychologists in Washington to prescribe certain mental health medications under strict conditions. It aims to make psychiatric care more accessible by allowing trained psychologists to become prescribing psychologists after extra training and education. Upon completion, they'd be able to prescribe medications to patients who wouldn't have to see multiple doctors. These include psychotropic meds, which help manage conditions like depression, schizophrenia, bipolar disorder, and ADHD. Democratic Senator Jessica Bateman, the bill's prime sponsor, said the practice has been proven to reduce suicide rates in other states.
The goal of this bill is to increase access to psychiatric care, the psychiatric medications in Washington state. We all know that we have a behavioral health crisis, that we do not have a strong enough behavioral health workforce, and we've taken some significant steps in the last couple years to address that. This is one element of that challenge, which is access to psychotropic medications that so many Washingtonians need.
The bill was strongly opposed by the Washington State Psychiatric Association. Dr. Robin Berger.
Because it's not safe and it won't increase access to care. I started my career in psychology, but then went to medical school to gain expertise in prescribing, which involves understanding how drugs affect the whole body. After 15 years as a physician, I am still humbled by the complexity. I know that it can't be understood in the proposed 1,000-hour training, half that of a nurse practitioner.
Opposing Berger's stance, clinical and prescribing psychologist Dr. David Shearer testified in favor of the bill.
Prescribing psychologists are as safe as other prescribers. There's a study showing that having prescribing psychologists lowered the suicide rate by 5 to 7% in New Mexico and Louisiana, the states that have had prescribing psychology the longest. To make that real for us here in Washington, if we had prescribing psychology here, that would equate to 28,000 lives saved over the next 20 years.
The Washington State Medical Association also spoke against the measure, saying it would do more harm than good.
That the potential for patient harm, in our collective opinion, outweighs the benefit that could be seen under this bill. We don't believe the net effect of this bill will be to meaningfully increase workforce, because granting psychologists prescriptive authority will not increase their capacity to see more patients.
Other supporters of the bill, like pediatric prescribing psychologist Steve Curtis, said it would improve children's access to mental health care, including those with disabilities like autism.
Neurodiverse children struggle to find quality psychiatric care when needed. Children falling through the gap between what their PCP can do and inpatient hospitalization. Without good care, these children are prone to more intense depression, school failure, substance abuse, and even suicidal actions. Waiting until a child is sick enough to need hospitalization is the reality for many families, and that is fundamentally unfair to the child.
If enacted, the bill will bring Washington State in line with other states like Idaho and Illinois that allow psychologists to prescribe under similar conditions. As always, full hearings are available to watch on demand at tvw.org. Links to TVW's live coverage of committee hearings can be found on the legislature's website, leg.wa.gov.